Breaking news right now in Raleigh. Governor Roy Cooper and state health leaders are giving an update on our response to COVID-19. Let's listen in.
In 60 counties throughout North Carolina. As expected, our numbers continue to increase rapidly. This is a highly contagious virus that's deadly for some. To continue our aggressive battle to slow the spread of COVID-19, today, I have signed a stay-at-home order for the entire state of North Carolina. Enforcement begins at 5 p.m. on Monday, but we urge you to start as soon as you possibly can. It's what we have to do to save lives. It has the force of law. This order directs you to stay home unless you need to leave for essentials such as your job, food, medicine, outdoor exercise, or to help someone. It bans gatherings of more than 10 people and directs everyone to stay at least 6 feet away from each other. This is known as social distancing. We've heard a lot about that, but it's really physical distancing. The order allows essential services to continue and directs those businesses that need to remain open use a strong social distancing policy. These are tough directives, but I need you to take them seriously. Although we're physically apart, we must take these steps together in spirit. Even if you don't think you have to worry about yourself, consider our nurses and hospital staff, doctors, people who will be stretched beyond their capacity if we're unable to slow the spread of this disease. Consider your families. Consider your friends, people that you might infect if you're carrying the virus. We need to keep them safe. North Carolina is now considered by the CDC to have widespread transmission, meaning that some people who've tested positive don't know how they got it. They didn't travel anywhere. They weren't in contact with a known positive person, but now they find themselves sick with the virus. Because no one is immune, because there is no vaccination, the best scientifically proven tool we have to slow the spread is keeping our physical distance and staying at home. Now, I know this order may lead to even more hardship and heartache. Many of you are already doing what you're supposed to do, even though it means that you're isolated or that you might have lost your job. That's a difficult situation. So thank you for doing the right thing. And I'll do everything in my power to try and cushion the economic blow. Because I've made benefits easier to get with my executive order, we've had more than 200,000 unemployment claims filed, with most of them citing this pandemic. The first COVID-19 unemployment benefits will be paid next week, and I am fighting for federal and state help for workers, their families, and businesses. We will not forget those who've lost their livelihoods in this crisis. Being apart from family and friends is difficult. Working via conference call or webcam can be frustrating. The sounds of our lives, the school bell or the halftime buzzer, they're gone. Losing your job or closing your business has to be difficult. But we have to act now in the safest, smartest way while we have the chance to save lives. It is truly a matter of life and death. And even with the uncertainty of these times and the new pace of our lifestyles, we know that the good part of our lives as North Carolinians will return. We fight this disease now so that we're better able to defeat it in the future. Thank you for heeding these orders and for your patience. And as always, a special thanks to our healthcare workers and their dedication to this state. We're all grateful for you. We're all praying for you. Today I'm joined by Dr. Mandy Cohen, our Secretary of the Department of Health and Human Services, Mike Sprayberry, of our Director of our Emergency Management, and Eric Hooks, our Secretary of the Department of Public Safety. Sign language is being provided by Nicole Fox and Monica McGee. First, I would like to ask Dr. Cohen to come forth and add a few words and updates. Dr. Cohen.
Thank you, Governor. I'm grateful for your strength, for your fortitude in the face of such uncertainty, and your willingness to act decisively to protect the health and safety of North Carolinians. One only has to look around the world to see the devastating consequences of the virus. The data coming out of Italy and China is sobering. In Italy, 29% of people who tested positive for COVID-19 had severe or critical illness. In China, it was 19%. Early data from the United States paints a similar concerning picture. The Centers for Disease Control and Prevention estimates that between February 12th and March 16th, somewhere between 20 and 30% of people who tested positive for COVID-19 in the United States were hospitalized, with 4 to 11% needing intensive care. While these studies don't give us the complete picture of the virus, they are certainly extremely worrisome. We are aggressively working to learn as much as possible about the virus across the country and here in North Carolina. At the same time, we do not have the luxury of time. We must act quickly based on what we do know to slow the spread of the virus. If we do not act preemptively to slow the virus right now, many people will get sick at the same time, which could overwhelm our medical system and compromise their ability to provide care. I've heard from many hospitals, physicians, and other clinicians concerned about that surge in demand and how it could overwhelm them and cause suffering and harm. Both the North Carolina Medical Society, the North Carolina Healthcare Association, which represents doctors and hospitals across the state, have warned about potential shortages of supplies and equipment and hospital beds. No one wants that to happen. And the only way to prevent it is for fewer people to get sick at the same time. That's what flattening the curve means. Our best weapon is social distancing. What we can do today can save lives in the weeks and months to come. And the more social distancing actions we can take and stick to, the more likely our healthcare system will be there for everyone who needs it. Our actions, your actions, can save lives. Staying home saves lives. If you have to be out, stand 6 feet away from other people to lessen your chances of catching COVID-19 or infecting someone else. Remember to wash your hands frequently, cough into your elbow, and if you feel sick and have mild symptoms, stay home and call your doctor. But that's not all. There are other things you can do to reduce your risk for serious illness. We know that those with underlying lung disease or uncontrolled chronic disease like diabetes or heart disease can increase someone's risk for severe symptoms from the virus. So, what does that mean for you? If you have high blood pressure, work with your doctor to make sure it's controlled now. If you have diabetes, make sure you're managing your blood sugar now. If you were thinking about quitting smoking, there's never been a better time. Do it now, and importantly, don't vape. Make sure you're getting exercise and are eating healthy. And let's give ourselves and our loved ones the extra care and patience that they need. Take a walk outside, give yourself a break from the news, check in with neighbors and friends and family by phone or by video, and ask for help if you need it. Many behavioral health clinicians in North Carolina are ready to take new patients and provide care over the phone or by video. More information is available on our COVID-19 website under Managing Your Overall Health. There are many things that we are not able to control, that are not within our limits, but it's up to us to act where we can. We can do this, we are strong, and we are in this together. Thank you.
Thank you, Dr. Cohen. You can text COVID-NC to 898-211. You'll get several notices a day via text. There is a wealth of information there, and it will answer a lot of your questions. You can also call 211, and they can route you to the resources that you need. I'll now call on our Director of Emergency Management, Mike Sprayberry. Mike.
Thank you, Governor. Good afternoon. Today is day 18 of State Emergency Operations Center activation for the COVID-19 response. We have 51 counties with their local emergency operations centers activated. 95 counties in the eastern band of the Cherokee Indians have declared local states of emergency. With today's new executive order, I know there'll be a lot of questions. A team of attorneys has worked hard to craft that order, and a frequently asked questions document to go with it to explain it as clearly as possible. That FAQ document is available on the state's COVID-19 website at ncdhhs.gov/coronavirus. I want to stress that businesses that are allowed to remain open under the executive order will not need to have any extra credential or permit to continue operations. Businesses should review the executive order and the FAQ document carefully to determine whether they may continue operations. In cases where a local order and the state may differ, the more restrictive requirement will apply. We have an expanded team here at the State EOC that continues to work aggressively every day to locate and acquire needed personal protective equipment for our healthcare workers and first responders, including masks, gloves, and gowns. National Guardsmen are receiving, inventorying, and shipping supplies out quickly after they arrive at our warehouses. We're also working to prepare for the surge of patients expected at our hospitals. We're identifying facilities that can serve as overflow for our hospitals, and the U.S. Army Corps of Engineers is helping to prepare facilities. As the governor said, North Carolina 211 continues to help hundreds of people every day with assistance and information related to the coronavirus. By dialing 211, people can get help with food assistance, paying rent and utilities, and basic information. He also said, you can receive information from 211 by text. Just text COVID-NC at 898-211 to get regular information updates via text. People at the federal, state, and local level are working hard to make our state safe. With everyone's cooperation and positive attitudes, we're all going to get through this together. Thank you very much. Thank you, Governor.